Hey guys, this is Dr. Hub. Today we look at the classification and this is going to be of the antacids. So we're going to classify antacids and look at their considerations. So first, to begin with, we look at the aluminium compounds. So first we are going to look at the aluminium compounds. So these under aluminium compounds, we are focusing on the aluminium hydroxide. So this aluminium hydroxide is used to treat the hyperphosphatemia. The hyperphosphatemia, and it can also, by this it can also cause the hypophosphatemia. So it can also lead to the hypophosphatemia. Next is we look at the aluminium hydroxide. It can reduce the effects of tetracycline. So this aluminium hydroxide, it reduces the effects of the tetracyclines. The warfarin sodium, as well as the digoxin and digoxin. So after this, what is the effect of this? It can reduce so what it does, it reduces the phosphate absorption. So it reduces the phosphate absorption and thereby causes hypophosphatemia and causes the hypophosphatemia. Next is, in terms of the aluminium compounds, it contains the significant amounts of sodium. So it has significant amounts of sodium, and they should be used with caution in clients with the hypertension and heart failure. So it should be used in caution because of sodium in cases of the hypertension as well as in case of the heart failure. This is the most common effect of the aluminium compounds. The most common side effects, if you see, it is just going to be constipation. It is going to be constipation. Next, we are going to look at the magnesium compounds. So what are these magnesium compounds? So in terms of magnesium compounds, there is the magnesium hydroxide. So this magnesium hydroxide, it is also a saline laxator. So it is a saline, it can also be a saline laxator. And the most prominent side effect, so what is the side effect of this? So in case of magnesium, it leads to, the side effect is diarrhea. So in case of magnesium, it's going to be diarrhea, and it is usually administered in combination. So this magnesium hydroxide, it is usually given with, that is combination is with the aluminium hydroxide. So it is given with the aluminium hydroxide, and this is an antacid that assists to prevent diarrhea. So this aluminium hydroxide, it is given to prevent the diarrhea. So earlier we saw that the side effect of aluminium hydroxide, it was the constipation. So here you give it to prevent the diarrhea. Next is, moving on to the other magnesium compounds. They are contraindicated. These magnesium compounds, they can be contraindicated. That is, it is contraindicated in clients with the intestinal obstruction. In patients with the intestinal obstruction, as well as in case of appendicitis and in case of undiagnosed abdominal pain. In case of undiagnosed abdominal pain, so it is contraindicated in intestinal obstruction, appendicitis, as well as in undiagnosed abdominal pain. Next, we move on to, in case of the patients with the renal impairment. In case of the renal impairment, what is to be done? So in terms of the renal impairment, the magnesium, there is something known as there's magnesium. So this magnesium, what happens is it accumulates to high levels. It accumulates to high levels, and it causes sign of toxicity signs of the toxicity. Next we move on to the calcium compounds. So in terms of calcium compounds, the calcium carbonate can cause the calcium carbonate. So what this does is it causes the acid rebound. It causes acid rebound. Next is the calcium compounds, other compounds. They are rapid acting. They are rapidly acting, and what happens is it releases the carbon dioxide. So it is rapidly acting and it releases. What happens is it releases the carbon dioxide in the stomach. So the calcium compounds are rapidly acting and release the carbon dioxide in the stomach. So it releases in the stomach and then it causes the belching and flatulence. So it causes the belching and flatulence. So it results in belching as well as flatulence. Next, moving on, looking at the other side effects. In case of the calcium compounds, the common side effect you can say is constipation. So earlier constipation was seen even in case of aluminium. So here also the calcium carbonate, it can cause acid. It can lead to the common side effect being constipation. So constipation, this is the most common. So we're going to write MC, that stands for most common. Then there is something known as the milk alkali syndrome. There is milk alkali syndrome. So this milk alkali syndrome, what does it cause? It causes, there is headache. Next is urinary frequency. Then comes, there is anorexia, nausea, as well as vomiting, and fatigue. So they can occur. The client should avoid milk products and vitamin D supplements. So to avoid, so what is to be avoided? To be avoided are nothing but the milk products. So the milk products are to be avoided along with the vitamin D supplements. Lastly, we are going to look at the sodium bicarbonate. So the sodium bicarbonate. So the sodium bicarbonate, it has a rapid onset. So there is rapid onset and it liberates the carbon dioxide. So the sodium bicarbonate, it liberates the carbon dioxide, and this release of carbon dioxide, it increases. What does it increase? It increases the intra-abdominal pressure. So it increases the IAP and it promotes the flatulence. So it promotes flatulence. Next is the sodium bicarbonate should be used with caution. So the sodium bicarbonate, it should be used with caution, and this is in patients with the hypertension and heart failure. So in case of hypertension and heart failure, you have to use it with caution. Next is in terms of it can also cause the adverse effects. So it can also lead to the systemic alkalosis. It can lead to the systemic alkalosis. So there can be systemic alkalosis, and this is in clients with renal impairment. So in case of clients with the renal impairment. And next is the sodium bicarbonate is useful for treating acidosis. So what is the use? It is useful in case of the treating acidosis treatment and also elevating the urinary pH. So it also elevates the urinary pH, and this is to promote. So what does it do? So this promotes the excretion. So promotes. So it promotes the excretion, and this is a what of the acidic medications, excretion of acidic medications following the overdose. So it will be following the overdose. So this was about the antacids, and we also saw their considerations, that is we saw what are they used for, where it is contraindicated, and that is where it should be used with caution, as well as we saw some common side effects. So to learn and grow daily like this, please do subscribe.